Today I'm going to address what I've found to be some of the top myths with ADHD and hopefully shed some light on the truth behind this disorder. I'm Angela Irvine. I'm a registered provisional psychologist here in Medicine Hat and a very proud member of the Medicine Hat Counseling Collective. Currently, I work with many children and adults seeking help for the challenges that come with Attention Deficit Hyperactivity Disorder. Today, I'm not only here as a professional, but I'm also here as a mom. I currently have 2 twin boys that live with ADHD, and they have been my greatest teachers in the challenges, how to overcome the challenges of ADHD, as well as how to embrace the positives that come with this disorder. I would like to thank the Niwa family and all of those involved with the Brandon Niwa Legacy Fund for providing this important opportunity to shed light on such topics. I also would like to thank those who have shared pieces of their story and have shown the courage to do so others can share pieces of theirs. This is something I see all of the time, and I see parents come in my office regularly blaming themselves for their child's challenges. Often, ADHD is blamed on lack of discipline, poor parenting, poor diet, or just plain problem children. This is certainly not the case. ADHD is a neurodevelopmental disorder. This is a disorder of brain structure and function. ADHD is characterized by deficits in all areas: personal, social, academic, and occupational. The range of deficits can vary, but almost always there's an impact across all environments. The current prevalence of ADHD is thought to be about 5% of children and approximately 4% of adults. That probably means that in Medicine Hat alone, there are 2,700 individuals coping with ADHD. ADHD is highly heritable, and there is definitely a genetic link. Studies have shown that 1 in 2 dads of children with ADHD also have ADHD themselves, and 1 in 5 moms. Often when children are referred to me or come to me, I hear they just have trouble paying attention. They just have trouble in school. It's just ADHD. I know it's meant to be well-intentioned, but this often minimizes the struggle that kids and adults with ADHD go through. I like to think of ADHD as an iceberg. On the top, we see that extra energy, that inability to pay attention, but underneath the water, there's a whole host of other things going on. ADHD is seen to be just a disorder of attention and being hyperactive. But in addition to attention, energy, there's also emotional regulation and social skills deficits that come with ADHD. In regards to attention, often it's thought that kids with ADHD or adults with ADHD just don't pay enough attention or can't pay attention, but in reality, they're paying attention to everything around them at all times. It's their inability to regulate that attention and to focus in on the thing that they have to focus on that can become the problem. A common characteristic of ADHD is what people refer to as hyperactivity, or the energy level of ADHD. But we can have ADHD without the hyperactivity, and you can be a hyperactive person without the ADHD. So yes, hyperactivity can be one of the characteristics of ADHD, but I've also seen the opposite side, something called ADHD paralysis. ADHD paralysis is when we want to get started to do something, but we just can't seem to get ourselves going. It is a problem with executive functioning. Executive functioning is the brain's self-management system, and this works differently for people with ADHD. Executive dysfunction in ADHD can look like inability to initiate tasks, organization, scheduling, sticking with tasks, and self-monitoring to see how we're doing when we complete a task. Now, social skills. 50 to 60% of children with ADHD face peer rejection. They have difficulty maintaining relationships. Often children, or even adults with ADHD, can be viewed as intense or demanding, when in actuality, They're just struggling with those social interactions. There's a difficulty to follow or maintain conversations. If you can't pay attention or can't sustain that attention, it's hard to stay on track. Often, impulse control for individuals with ADHD is also difficult, and this can create sometimes behaviors that are seen to be bothersome by others or irritating or annoying. For the person with ADHD, it's difficult for them to even control those impulses. So they face that peer rejection. Difficulty with planning or following through for adults with ADHD can lead to that reputation of someone that can't be counted on. Remember that executive dysfunction we talked about? This plays roles in peer relationships as well. Emotional regulation. A lot of individuals with ADHD face difficulties with boredom tolerance. They can't tolerate boredom or become very agitated. Frustration tolerance, high excitability, temper outbursts, and sometimes mood fluctuations where they go from one extreme emotion to another. It is suspected that the brain connectivity networks that carry emotional information are not functioning the same as individuals with ADHD, so they feel emotions more intensely. In addition, individuals with ADHD can also have difficulty differentiating between major and minor events, and the ADHD brain is wired for instant gratification. That instant gratification comes from these intense emotions. In addition to the four main areas of symptoms, there are also functional impairments that come as secondary in that ADHD iceberg I mentioned earlier. For children, this can include behavioral disturbances, school failure, difficult peer interactions, low self-esteem, accidental injuries, and often psychiatric comorbidities. For adolescents, this can mean school suspensions or expulsions, not completing high school, increased risk of substance use, involvement with the justice system, promiscuity and higher risks of STIs, and an increased rate in teen pregnancy. In adulthood, ADHD can sometimes mean increased risk of suicide, lower completion of post-secondary training, higher rates of divorce, higher rates of substance use. With this list of these functional impairments, it's no wonder individuals with ADHD need the support and treatment to overcome these challenges. There are a lot of variations in the experiences of ADHD. In the Diagnostics and Statistics Manual, the book that we use often to refer to for diagnostic criteria and identify disorders, identifies three main types of ADHD. One is ADHD predominantly inattentive, ADHD predominantly hyperactive, and ADHD combined. ADHD predominantly inattentive means that the primary characteristic or the most noticeable characteristic will be that inability to sustain attention or that inability to regulate attention to be able to function in the way you need to in your environments. ADHD predominantly hyperactive type is where the increased energy level and hyperactivity will be the primary characteristic that is noticed. This is the least common type of ADHD, and they'll have the least amount of problems with sustaining that attention and concentration. ADHD combined type is the most common type of ADHD diagnosed. It includes inattention, distractibility, hyperactivity, and usually impulse control difficulties. Other considerations we want to take when we're diagnosing ADHD or supporting someone with ADHD is, are there any comorbidities going on? Are there any other disorders that might be contributing and playing a role in the challenges of somebody with ADHD? Often this is the case. Children and adults with ADHD can often also struggle with attention, depression, OCD, learning disability, language disability. This disorder also is commonly paired with the diagnosis of ODD or oppositional defiant disorder. Now, I separate out this disorder because it's a little bit different in my mind when it comes to ADHD. Many individuals and children qualify or meet the criteria for the oppositional defiant disorder diagnosis. But in my experience, it is often a secondary diagnosis in response to the challenges of the ADHD. Do children and adults sometimes meet the criteria? Yes, but we have to remember this is a descriptive diagnosis, one that is often misunderstood. If we deal with the primary challenges of the ADHD, we often will see oppositional defiant disorder characteristics diminish. We also want to consider the severity of symptoms. What is the impact of the ADHD symptoms on the individual? This will help guide us in our treatment planning and therapy planning and help us know what priorities there are for the individual. Myth number 4, and something that I hear all of the time. Well, he can focus on video games for hours at a time. He can't possibly have ADHD. Well, actually, this is something I see very common in ADHD and in my own children as well. Remember when we talked about that attention regulation? ADHD is not being able to pay attention, it's not being able to regulate that attention. So sometimes when motivation is high, those kids lock into something and stay there for hours. But where the problem is that they don't notice anything else that's going on around them. So we can have these conversations and they don't even know. So we have to break that concentration from the video game to be able to get them to respond to other stimulus in the environment. This is commonly referred to as difficulty in shifting gears. It's not the activities that are the problem, it's transitioning from one activity to another and shifting gears so our attention can focus on something else. In some instances, therapists refer to this hyperfixation as almost self-medicating for individuals with ADHD. They're looking for a way to regulate and give their body the stimulus that it's so craving. If we can give the body the stimulus, then we get a hit of those neurotransmitters in our brain we're craving and looking for. Now, why video games? Because not every kid has this difficulty moving away from video games. What we find is this is one of the most common hyperfixation points. Individuals with ADHD are drawn to activities that give that instant feedback, that give us that instant gratification. Video games and the stimulus video games bring do just that. Now, this doesn't seem to be such a big problem sometimes, except if you look across environments, hyperfixation can cause a lot of different difficulties. It can lead to school failure for children, lost productivity for adults, and it can have a significant impact on a lot of peer relationships or intimate relationships. Is hyperfixation or this honing in on something a problem all of the time? Well, we'll get back to that in just a few minutes. Boys are 3 times more likely to be diagnosed with ADHD, but this doesn't mean that girls aren't susceptible to this disorder as well. Boys are often diagnosed sooner and more frequently because they tend to show more of the externalizing symptoms of ADHD, the hyperactivity and impulse control, whereas girls will show more of the internalizing characteristics of ADHD. Withdrawal, anxiety, daydreaming, and trouble focusing are very common for girls with ADHD, but not always caught or understood. Girls are often diagnosed much later than their male counterparts, and in fact, some even wait until adulthood. This can be challenging because it can often lead to delayed treatment or delayed supports. Differences in presentation of ADHD between the genders can often lead to a misdiagnosis in girls as well. Sometimes mood disorders, bipolar disorder, OCD. So it's important that we look closely at that ADHD iceberg. Okay, this is what we expect to see on the top, but what's going on underneath all of that water? If ADHD is missed in girls, it often leads to secondary problems such as anxiety, depression, perfectionism, even risk of self-harm or eating disorders. More than 50% of children diagnosed with ADHD continue to experience symptoms into adulthood. In adulthood, symptoms can evolve over time and shift and change, but the challenges often remain very similar. Difficulty organizing in childhood can lead to poor time management as an adult. Squirming or fidgeting as a child can often lead to that feeling of restlessness as adults. Blurting out answers or unable to wait turn in class can lead to adults maybe taking over tasks that others were supposed to complete. In adulthood, hyperactivity will often decrease, but the impulsivity and the difficulty with attention can stay the same. There's often a discussion about adult ADHD and whether adult ADHD is a new or separate disorder. In many cases, adult ADHD, if you look at the history, it was present in childhood. It just simply wasn't recognized. In adulthood, ADHD symptoms can also be masked by comorbid disorders. So again, if there's a struggle with anxiety or depression, the ADHD component may be missed, but it's very important to understand that iceberg and what's going on underneath it. ADHD is a medical and psychological disorder that needs support and treatment. Most individuals with ADHD are working extremely hard just to hold it together to get through the tasks that they need to do in a day. If left untreated, there are many secondary risks and problems that can arise. Higher rates of family conflict, higher rates of divorce, underachievement, lowered self-esteem, higher rates of suicide, higher rates of unemployment or difficulties maintaining employment, higher risk of accidental injury, higher risk of substance use, promiscuity, and risk of sexually transmitted diseases, higher rates of involvement in the justice system, and higher rates of secondary disorders. Effective treatment of ADHD often includes a multidisciplinary and multimodal approach to treatment planning. Often first line of action in the medical treatment of ADHD is a psychostimulant medication, but if not tolerated, there's other families of medication that can be made available. Often there is a great deal of stigma or fear around the use of medication for the treatment of ADHD. Education is important, and asking those questions of your family physician is also very important. Medication is not a cure-all by any means. There's other supports needed for individuals with ADHD. Medication simply helps in the slowing down so individuals can engage in the supports and therapeutic work that they need to do to overcome the challenges. Often it is recommended that the best treatment is a combination treatment of pharmaceutical intervention and psychosocial interventions. Psychoeducation of the individual experiencing the challenges of ADHD is very important so we can reduce the stigma and help them better self-advocate for themselves. Parent and family training is also critical. I see time and time again moms and dads coming into my office blaming themselves and the guilt that they carry because their child is struggling so much with this disorder that maybe is not understood by everybody. The support of parents often involves clarifying myths, providing choice and options in treatment planning, and identifying the stigma and demystifying the stigma and helping the parents cope with the guilt that they're carrying. We talked about the social skills difficulties that can come with ADHD. Social skills training is critical in ADHD support. It's meant to address any social skills deficits, any difficulties in interacting with peers. It can be used to address any difficult circumstances that the individual is facing in their relationships and help them come up with solutions. Counseling and psychotherapy can also be beneficial for individuals with ADHD. It can address poor coping mechanisms, any cognitive distortions that may be present because of the ADHD experience, as well as identifying behavioral interventions that might be beneficial. When looking at behavior, we have to remember that behavior is communication. That behavior serves a function for that individual. It meets a need. So it's not about just getting rid of the behaviors that they don't like or that we don't like. It's about addressing what function is being served by the behavior and what replacement behavior can they learn to overcome the challenging behaviors. We want to move away from the label of willful behavior and punishing behavior. We don't want to punish a child for something they can't help. My favorite Ross Greene quote, and it's true, children will do well if they can. If children had another way to behave, if children had a more functional way to behave, they would do so. So it's time to put that thought of this is a willful, purposeful behavior aside and really look at this as a method of communication and how do we help that communication. In supporting individuals with ADHD, part of the treatment plan really should be about school work accommodations as well. What are the environmental barriers that might be present and how do they clash with the ADHD characteristics? Can those be accommodated or supported or changed in any way to make it easier for the individual with ADHD to show them their best selves? I get asked all of the time if somebody with ADHD also has a cognitive impairment. Right now, there are no confirmed links between ADHD and intelligence in the current research and literature. ADHD can affect the individual's ability to function or perform. If these difficulties in efficiency are accommodated for, individuals can then show their best and show what they actually know. I see my job in supporting individuals with ADHD as helping them to show their best selves. What are the barriers that need to come down for them to have the same opportunities as their peers? It's not about equality, it's really about equity. Some of these include extra time to complete tasks, working in a distraction-free environment, building breaks into a work or school schedule, providing opportunities for movement, assistance with scheduling and planning, and peer support or modeling. When provided with supports, individuals with ADHD can show numerous unique strengths. Some of the time, it's just us needing to look at those strengths in a different light. Where we see distractibility, can we start to see it as curiosity? Forgetfulness, could that be seen as living in the moment? Can't stay on topic, or is it that they're seeing things that we may have missed? Hyperactive, man, he's energetic. Impulsive, can we view that as creativity? Disorganized, those are our spontaneous friends. Stubborn, isn't that persistence that keeps them going day in and day out? ADHD gives an individual a unique perspective on life and encourages an approach to tasks with a thoughtful eye. This can often result in inventive thinkers that are seen as original, artistic, creative, thinking outside the box. At times, ADHD can even be a benefit, and I see this in my own household. That energy level, depending on the task, can be really helpful. Often individuals with ADHD have higher creativity, are innovative thinkers, and think outside the box. They generate more ideas. ADHD is a complex disorder that impacts many in our community. Without the understanding of the impacts of this disorder and the need for supports, individuals will continue to struggle and our community will lose those innovative, creative ideas they may be able to share with us. I think the advice I would give to parents is to let go of that guilt. That's not guilt you earned, that your child's going to be okay. We see the awesome in your child. We just need to accommodate that ADHD and provide the support so that awesome can shine through. To somebody living with ADHD, speak it. It's okay to speak it. It's okay to speak your experiences. The more you speak it, the more you'll realize that others around you are having similar challenges. It does get better if you're struggling right now. There is support available. There are treatment possibilities. And so I hope that each one of you will find the opportunity to let your best self shine and to reach out to others who may also be having challenges. It is my hope that as we dispel the myths and provide clarity around the misunderstandings, the stigma will lessen, support will be readily available, and each person will have the opportunity to show their best selves.